Hi family, Dr. Hooten here, coming at you from Hooten Family Healing Center in Dallas, Texas. I'm going to talk to you today about vitamin D3, a crucial part of your cancer fighting system, your entire immune system, how your body handles inflammation. For those of you that have arthritis, if you want to help your body, you need to pay attention to this video all about vitamin D3. So I'm going to break down what vitamin D3 actually is, and then further go into how it helps you fight cancer and a bunch of other ailments. So strap on and listen up. Vitamin D3 is actually a hormone and a vitamin. It's also known as a prohormone. A lot of people don't understand how it's manufactured in your body. Well, you actually make this stuff via sunlight. So you go out and you get some sunshine, which we should be getting, 30 minutes a day. The sunlight comes in, UVB rays hit your skin, goes through your eyes, and your brain recognizes that now you're taking in these UVB rays, and it tells your body to manufacture your own vitamin D3. Now, how cool is that? You have a natural cancer fighting system built into your body via the sunlight. Now, how does it do that? Because it doesn't just poof, make the vitamin D3 out of thin air. Your body has this other stuff in it that it uses to manufacture the vitamin D3. And that other stuff is called cholesterol. So on a little side note there, how can something be bad for you that your body uses to make vitamin D3 and a host of other hormones? And the answer is it's not. Cholesterol is not bad for you. What's bad for you is your behavior. You have to make sure you're living a clean life. You're getting adjusted. You're eating clean food. You're not living a stressed out life and not taking care of your mental states. You got to live a clean life and your cholesterol is just fine, and your body will use that to make vitamin D3 and all your other hormones and helps everything. So cholesterol is really a master hormone. Vitamin D3 is made from it, from the sunlight. Now, most of us don't get nearly enough sunlight. That's where supplementation comes in. So how do you know if you have enough vitamin D3 in you? Well, one way is to test. I like to take 5,000 IUs every day anyway. What I've seen through testing is that most people need about 10,000 IUs a day to get their vitamin D3 levels up to 60, 70, or 80. Now, it's very hard to get toxic from this. I wouldn't tell you to take 20,000 IUs a day for 3 months, because then your stomach can't digest that and you might throw it up. I've only seen that one time in 19 years. And we tested that. She was a teenager, and we tested her blood, and she had over 100 in her vitamin D3 levels. So we said, okay, look, you're getting enough sunshine. You don't need to supplement this. Every single other person, including my family, were a little bit low. We were running in the 50 to 60 range, and I want to get this up to 80. So we got it up into the 70s. Now, why is that important in your fight against cancer? Vitamin D3 has a unique ability to get into a cancer cell and affect it. What it does is it goes in and turns this gene on in a cancer cell that causes the cell to die off. Now, if you've been to any of our cancer workshops or watched our cancer videos, I break that down even further. But just know that vitamin D3 causes a cancer cell, a gene inside the cancer cell to activate that'll cause the cell to die. So it doesn't actually poison the cell. It gets in there and activates this gene, and then the cell goes through a natural life cycle and dies off. And that's a fundamental problem with cancer, is that once you get a tumor, once you get these cancer cells, they don't die. They just keep multiplying, and the host cell doesn't die off. So if you need more understanding about that, I would encourage you to go back and find some of our cancer videos. I have some long ones, I have some short ones. But vitamin D3 will get in there and activate that gene that'll cause the cancer cell to die off. So I don't know about you, but I don't want to get cancer. This is a very, very easy way to help your body maintain a cancer fighting state, and that's vitamin D3. So I call this one of our core supplements because everybody that I've tested, except for that one kid, was low, and most people were radically low. If you want to see what your vitamin D3 is, we can order you a blood test here at the office, and you take the form and you go to LabCorp. You don't even have to have an appointment. You walk in. Here it is. I think the test here is maybe $50. You can see our front desk. See Christine about that. And or Dee or Dr. Angela, she can help you through that. And then that would give you a baseline. I'm not suggesting everybody do that, only because everybody we tested out of the thousands was low except for that one person. So if you're an adult, I would suggest you take 5 to 10,000 IUs per day. And the formula we use has probiotics in it, a couple other things to help you digest it. There's a little ingredient here called magnesium stearate. It's a vegetable source, but some of you have noticed that you have an issue with magnesium stearate. If that's the case, C, D, and Christine, and they'll help you go find one that doesn't have that in there. It's a vegetable source, so it's not going to hurt you, but if you are sensitive to it, we'll show you which brand to get. The only reason we have it in there is because it's very hard to make this stuff at the levels that we need in the 5,000 IU range without it. So again, that's not going to hurt anybody unless your stomach has issues or your digestive system has issues, and then see us and we'll help you through it. But I like this brand. It's very inexpensive for what you're getting. This is obviously our Max Living brand. If you need any help with that, if you have any questions, see my team. You can always email us, reach out to us. I take 5,000 to 10,000 every day. Now, one thing I wanted to touch on is, we're coming into allergy season, right? How many of you have allergies? And I would guess you're in the 50 to 60% of you watching this video at any given time have allergies. Now, why does everybody get allergies at this time of year? I guarantee you it's not because the spring is blowing stuff in, although that is true. The problem that I see is that most people spend time indoors from about October to February. We're not getting any sunshine at all. And if you're not supplementing at all and you're eating a standard American diet, which is crap, and you don't get adjusted, then your immune system is going down gradually from Halloween on. Of course, you're going to come into the spring season with all this stuff blowing in, especially in Texas, and your immune system is going to blow up. Supplement your vitamin D3. If you're an outdoorsy person, make sure you're getting 30 to 45 minutes a day, even when it's cold. Get into that sunshine. Your body wasn't made by mistake. God put all this power in you. You got to start treating it right. Core supplement, vitamin D3. Stay tuned. I'm going to go through other supplements this month. If you have anything, you need any help, reach out to us, and we'll do everything we can to help you. It's Dr. Hooten signing off. Talk to you next time.